if it's metal or glass, we can see it pretty well with ultrasound. Here's a nice foreign body in the eye. This one actually went just above the globe, so it didn't quite enucleate the globe. They were able to pull that thing out. He still had pretty good vision in it. Enucleated means it's squished, it's flattened, it's, yeah. The inside has been taken out. So like a nucleus of something, like when they do a discectomy, when you have a herniated disc, they take out the nucleus pulposus, they enucleate the disc to take it out. You can get lipomas. Remember, lipomas are just fatty tumors, right? And so remember, fat looks white on MRI. So this is the globe, and this is a lipoma behind the globe, pushing that out. So that person's right eye is sticking out a little bit. This person's left eye is sticking out because of this dermoid back here. Remember, dermoids with hair and teeth, and they can be anywhere. And this guy has one behind his eyeball. So those are benign. This guy has a dermoid under his eyelid. That's his eyelid. Again, how did he wait so long? Do something about that.
How could you go all that? I mean, years, right?
That had to be years, yeah. You can get hemangiomas behind the eye. Again, remember, they're just big collections of capillaries. Again, pushing the globe out, so he's probably having pain, probably visual disturbance because it's probably sitting right on the optic nerve here. It's benign, but I'm sure it's causing visual problems.
Is cavernous just where it's located?
Cavernous just means large. It just means large hemangioma. Another cavernous hemangioma seen in the axial view. Here's an MRI. In a sagittal view, you can see it right here in the fat. So hemangiomas are not uncommon in the comas. And those are benign. Gliomas are a little bit different. So glial cells are the connective tissue of the brain and the nervous system. And you can get tumors of the glial cells, and they can be benign or they can be malignant. This is actually a benign glioma sitting right on the optic nerve here. And this is the same patient, CT scan and MRI. This patient had two gliomas, and one on each side. You can't see this one on this particular view. These are not benign. These are malignant tumors. So remember I told you the optic nerve is actually connected to the retina, so it's actually part of the brain tissue. The optic nerve goes right back to the brain, and it crosses at the optic chiasm in the brain. And so the eye is the closest thing we get to the brain on the outside. And so these things are tumors. They're basically tumors that you find in the brain. You also can find them on the optic nerve here. This is called an astrocytoma. And astrocytomas are very aggressive malignancies. So this guy wound up having his eye, they had to take the eye out. They couldn't just take the astrocytoma out because it was wrapped around the optic nerve. This is a retinoblastoma. Retinoblastomas are malignant tumors of the retina. Again, retina is part of the optic nerve, is part of the brain. So retinoblastomas, unfortunately, it's really sad. We see them in little kids all the time. Not all the time, but we see them in little kids. Remember Derek Fisher played for the Lakers? Derek Fisher's daughter had a retinoblastoma. There he is. His daughter had a retinoblastoma, and he actually asked to be traded from the Lakers. I can't remember where he went. Oklahoma City. Okay, so there was a ophthalmologist in Oklahoma City who specialized in doing pediatric retinoblastoma-ectomies, I guess. And so she had her tumor removed. So this is the optic nerve that's invaded by the retinoblastoma. It gets into the vitreous humor. They're pretty nasty. This is a spoiler alert here. This is a disturbing slide. No, not this one. Retinoblastoma. This right up against the retina. It's a malignant tumor of the retina. Here's a coronal view. And again, it affects little kids. Babies are born with them. So, it starts off like this, kind of looks like a cataract on this little baby here. They can get larger and larger, and they can get gigantic. Again, this is not a kid in the United States, okay? This is probably a kid in India or deep Mexico somewhere that has no medical attention. It shouldn't get to this point, yeah? We do biopsies. This is actually not a biopsy, this is a sewing needle. You can see the eye of the needle right there. But this is a mass in the conus right here, and they can do biopsies of that little local anesthetic, so the patient not to move their eyes too much. What's the first thing the patient's going to want to do? Move their eye. It's like when we do thyroid biopsies and we tell a patient don't swallow, the first thing they want to do is swallow. So you have to go and stop swallowing, needle in your neck. This guy was in a motorcycle accident and got the brake lever.
Holy shit.
It's right here going into his maxillary sinus. So that's his CT scan. That's the brake lever sticking out of his blood, and the rounded part of it is going into his maxillary sinus. It hurts. This guy's in a bar fight. Oh, somebody rammed the bar stool leg into his eye. Okay, so one of the things that we look at when we do ultrasound of the globe is looking for detached retina. Detached retinas are pretty common. They happen with trauma. Boxers get detached retinas a lot because they're constantly getting punched in the head, in the eyes, in the face. And the retina is a pretty fragile thing. It can tear easily, and it can come off the back of the globe here. And we tend to see these little stringy things that are just kind of floating in the vitreous. Sugar Ray Leonard had, I think, 3 detached retinas in his career. He just kept getting hit in the face. So this is where detached retina, you can get them from diabetes, you can get them from trauma, and this is what it looks like. Remember, this should be black on ultrasound. It should be all vitreous and nice and black. And this is the retina that's lifted off from the back of the eye, and it's just kind of floating in the vitreous. Here's a little retinal tear back here. Again, that should be flat up against here. This is called a choroid back here. It should be flat against the choroid. This is a little hemorrhage. So there's blood that's lifting the retina off of the back of the eye, off the choroid. So that's blood in there. So these are things that we look for with ultrasound. Here's a patient who came in to the ER 2 years ago. She came into the ER and she was in a car accident, and she had multiple fractures, but she was having trouble seeing out of her right eye. And so they asked me to do a quick ultrasound. And again, remember, this should be all black, so there's all kinds of floaters in there, and this is her retina that's lifted off from the back. So she's got a torn retina. We can see floaters really easily. These are all these little snowflake things are floating. You know what floaters are? Like, sometimes if you look across really quickly and scan your eye, you'll see little things kind of floating across. Those are floaters, and they just come off. They're parts of the vitreous that just kind of get thickened. So a lot of people have 1 or 2 little floaters. This patient's got tons of floaters. They could laser those. They could go in there and laser them and break them up if they're really affecting the vision. You can get a melanoma on the retina. This is a melanoma that's sitting on the choroid. The choroid is the back part of the retina. And again, seen nicely with ultrasound, and then they had an MRI, and here's the melanoma sitting back there. Cataracts, again, see nicely with ultrasound. Remember the lens should be kind of a football shape going across here. And this is a hardened, thickened crystalline lens that has become basically opaque. You can't, it's hard to see through that lens. And so they do lens transplants now. Okay, we'll talk about the ear a little. Don't stick pencils in your ear. And then don't put the tweezers all the way in to get the pencil part out. What's the old saying that don't put anything larger than your elbow? Tooth fairy strikes out. This kid stuck his tooth inside his ear.
What?
That's in the external auditory meatus, and they pushed it way in there. Mom couldn't get it out, so she took him to the doctor, and I guess instead of just looking in there with an otoscope and trying to pull it out, they did a CT scan. Here's the tooth kind of lodged in his EAC. This patient has a deformity of the right mastoid. So, you know how it's supposed to be honeycomb looking, and here's an ossicle sitting here? This one's smaller, there's really no honeycomb appearance, it's just air, it's just black, and there's no ossicle in there. So this patient is probably deaf in the right ear, on the right side, because there's no ossicles to transmit the sound to the cochlea. So this patient would probably do well to have a cochlear implant. What's this right here? IAC, internal auditory. This patient has aplasia of the cochlea, so we should see cochlea and semicircular canals here, and we don't see any of it. They would just never form on that side. Beautiful ossicles. So they're trying to transmit sound, but the sound isn't going anywhere on this side because there's no cochlea, there's no organ of hearing on that side. You get fractures in the temporal bone. These happen a lot with T-bone accidents where you're driving and you get T-bone and you get hit on the side or your head hits the side window. You get fractures of the parietal bone, you get fractures of the temporal bone. This happens in babies. It's called craniosynostosis. And craniosynostosis is premature fusion of a suture. It can be any suture. This one, here's the sagittal suture, and when the sagittal suture fuses prematurely, as in this picture, you get this kind of a shaped skull. Okay? So the baby's head is still growing, but if this suture closes, it can only grow front to back. Okay? So they get this kind of shaped head, and that's what happened here, was premature fusion, premature closure of the sagittal suture. And they get this elongated skull. If the coronal suture closes too quickly, then they get a wide, round head. So here's premature closure of the sagittal suture. You don't even see it at all. And this is a baby. This is the fontanelle, the soft spot.
Nick,
Yeah.
does the brain still function properly in that?
Oh yeah, yeah, yeah. And this is why they tell you when you have a baby to make sure you change their head position when they're sleeping. Don't keep putting them down on the same side. This kid apparently always slept on the same side, and so he's got this weird shaped head now because it's flat on the side that the baby keeps lying on. Because the brain is really soft. It's really, the skull is really soft in a little baby. It's malleable. In fact, when these kids fall and they hit their skulls, they get what's called a ping pong fracture. It kind of dents the skull rather than fractures the skull. They will get fractures, but this is a kid who's been lying on the right side too much. It'll eventually fill out. As the kid gets older, it'll change its shape. And the kid will get hair, and you'll never know. This is a conjoined skull. These are two sisters that lived to their late 30s or early 40s in India. And they actually tried to separate them. They thought they could go in and separate them. So this is their 3D 3D CT scan, looking down from the top of their skull. And this is looking at the brain inside. So they actually, they shared too many structures in the brain that they weren't allowed to actually